I think early diagnosis really will help us, as it has in the case of breast cancer. And then as we understand the basic biology of lung cancer, we're starting to learn that all lung cancer is not the same, and that's going to be our next big step forward, I think.
Nowadays, you just cannot lump everyone with lung cancer together. It's a much richer story than that, and you just have to isolate different people, and I think that over the next few years we are only going to be knowing more about how these different groups behave and how best to treat them.
There is clearly reason for hope. Again, we've changed our therapies and the way we deliver chemotherapy, as well as the specific types of chemotherapy, so it's much more targeted to a patient.
The biggest thing is have hope. There are new things on the horizon. There are many new treatments, surgically, radiation-wise, as well as patient treatment trials and new drugs that have become approved and are going to get approved. So lung cancer is not the same thing as it was in the past. Many optimistic pieces of information are there for us to utilize so as to help patients such as yourself improve their quality of life and quantity of life and survival.
There are a lot of exciting new drugs coming that offer hope for our patients, and a lot of those trials and new drugs will be available here at Baylor Sammons, which is very exciting for the patients here in the North Texas area.
We are better than we've ever been at curing cancer, and even short of that, we can always help people with it, and that there are only more and more options all the time.
I think our advances have been actually so dramatic over the past few years that it's difficult to even say what the future holds. So a patient who is hearing the unfortunate news of having lung cancer today, it's very difficult. You can't Google it or Wikipedia and look at what it says there and think that will pertain to your future. Your future may be far brighter given all that we've learned over the past couple of years.
Patients who are looking for a hope for treatment, we have new therapies on the horizon. We encourage them to look for the newer ways of techniques for treatment and to participate in clinical trials and hopefully get the best benefit of what we have to offer today.